Let's talk health now. Diabetes is a medical condition characterized by high levels of glucose in the blood. It occurs when the body either cannot produce enough insulin or cannot effectively use the insulin it produces. Diabetes affects people of all ages, and most forms of diabetes are chronic, while others are manageable with medications and lifestyle changes. The types of diabetes include type 1, type 2, gestational, as well as latent autoimmune diabetes. Now, diabetes is also a major cause of blindness, kidney failure, heart attacks, stroke, as well as lower limb amputation. It can also damage blood vessels in the heart, eyes, kidneys, and nerves. Some of its symptoms include increased level of thirst, need to urinate more often, blurred vision, fatigue, weight loss, amongst others. Let's talk now with the health practitioner about this health condition. We bring in via Zoom from New Jersey, Assistant Professor of Medicine at the New Jersey Medical School. He's also a former medical officer, NEWA, Community Health Centers, and the president of Lennox Medical Group. Dr. Nelson Aluya, thank you for joining us on TVC Breakfast.
Well, thank you. Thank you for having me. I'm having a problem with the volume, though.
All right.
Can you hear me?
Right. I can hear you. I can hear you, though suddenly it's a bit faint, but we hope it does get better. But let's have your assessment. What are your thoughts on, diabetes as a health risk in this part of the world?
Well, it is a crucial issue because diabetes is on the march, and it's a huge march from the 1960s, where in this part of the world, well, I mean this part of the world, Africa. And particularly Nigeria, where the prevalence of diabetes was about 1%. In the 60s up to the 80s, and then by the 90s it was 2.2%. But today that has gone to 6% prevalence. But we know that that's a gross underestimation because a lot of the people who truly have diabetes in Nigeria don't seek care, most of them in the rural areas. But then because of the devastating effect, both on the individual and on the economics, it's a major health crisis. And 2016, the WHO and CDC eventually called it an epidemic. But from where I stand, what I see is particularly now a pandemic, as it may be. I've often called it the pandemic before the pandemic, meaning before COVID-19 pandemic.
And, in this part of the world, like you have mentioned, to an extent, some persons still have issue, identifying some of these symptoms. And that's why we still have a lot of persons having this disease, but do not even know they have them. So can you talk to us about the symptoms? And what are the reasons? Probably, is it as a result of, what we consume? Why is it relatively high at this point?
Yes, a whole lot of things that really occurred when it comes to diabetes in Africa, and particularly in Nigeria. One is the urbanization that's taking place, where often enough, if you want to see grandma, you just go walk to see grandma. But now it's, phone, everybody talks on the phone, nobody really walks anymore. To the diet, we begin to eat or live more in a Western style, and that alone is a huge contributing factor to the fact that diabetes is on the rise in Nigeria, and not just Nigeria, it's across the globe, as a matter of fact. And this urbanization, increasing amount of eating foods, particularly high on refined sugar, it's a big problem. And the lifestyle in the sense that, we are not as active as we used to be. It's another one as well. And then, the sedentary lifestyle that we'll begin to adopt in Nigeria is a pretty big contributing factor. Then, of course, you have, smoking, consumption of alcohol. All of those things put together is why this number has gone up drastically within the last, decade or so.
All right. So this is like at least a three-legged, discussion when you talk about the prevention, the treatment, and the ultimately perhaps the management in preventing this. Because earlier on, and from the little we've seen, it would have been automatic, or people would say it's automatic that if your ancestors had the disease at some point, it's automatic that those surviving also are at risk of it. But now, as you have said, because of lifestyle changes, we're having people who suddenly find themselves in that situation. I use that word suddenly rather cautiously, because from the little you have said, it's a build-up, so to speak. But let's speak about the preventions now.
Right. So not to go too technical, there's what we call epigenetics. And what it means is that the environment which you live affects how your DNA is expressed. It doesn't particularly change the DNA, but it's how it's expressed. So because of the changing environment that we live in, with those factors that I did talk about, from increased consumption of refined sugar, sedentary lifestyle, all of those has changed the way our DNA expresses itself with those inherent factors. So we do have a lot of people who do carry the gene, but it's expressed more because of the prevailing circumstances. So what do we do to prevent it? One, you have to identify if you do have the risk at all. What we particularly speak about here in our Western world, we talk about knowing your diabetic status. And how do you know that? You do what they call the hemoglobin A1C. Hemoglobin A1C is a blood sugar test that identifies the amount of blood sugar that's in your body within the last 3 months. And now it really tells you if, one, you don't have diabetes, if you're pre-diabetic, or if you really do have diabetes. 5.7 milligram per deciliter is the cutoff. Anything less, you don't have diabetes. 5.7 to about 7 with no symptoms, that puts you at a risk for pre-diabetes. Now, anything above 7 is considered as having diabetes. So you need to, if there's anything anybody will have to take out of this today, is so you have to know what your diabetes status is. Are you diabetic, pre-diabetic, or you do have diabetes? Because like you said, a majority, over 50% of people who walking around have diabetes or are pre-diabetic, they don't even know they have it. And it's often salient. But then the signs and symptoms we'll talk about. So, but if you know what your status is, then you begin to take steps to mitigating the risk of you becoming diabetic.
And when is the best time? When is the best time to check your status?
Sorry?
When is the best time, age bracket, I mean, when is the best time to check your status?
Well, as soon as you become an adult, 18 years and above, you should. But for kids, for children, I'm a pediatrician as well. Now, obesity is a big issue. Here in the United States, we've checked the map for diabetes and obesity. Truly do match completely. So if you are obese, you have a 70% chance of becoming diabetic, within the next 5 to 10 years. So for children who are obese, for pediatricians, you have to check. You need to check for diabetes, or if that child is at risk for diabetes. But Otherwise, you know, if you're an adult, 18 and above, you need to really screen for diabetes up to 100 years or whenever.
Right. All right. So let's talk management. You know, we're at a time where so many persons have access to all sort of information on social media, including treatment. We have online doctors who self-diagnose themselves and also treat themselves. Perhaps we should be exploring, you know, non-clinical remedies to this. You mentioned diet, you mentioned exercise, you also mentioned what we eat and also other factors. What do these, you know, these factors, what role do they play in ensuring that, okay, for those who have it, this can be managed, especially for those who do not want to, you know, undergo treatment?
Well, I'll begin by saying this, that the usual notion that what you don't know will not kill you, it's no longer the fact. Because what you don't know is really slowly killing you. And it's important that we all understand and know this. Knowing what your diabetes status is critical to your health. As you know, diabetes affects from the brain to the foot. The #1 cause of kidney failure in the world is diabetes, followed by hypertension. So, and we know what's happening with, you know, diabetes and kidney failure in Nigeria. Now, it's imperative that if you understand that you have diabetes, then the critical steps to do in taking care of yourself is one, finding that, you know, a good primary doctor who will take care of you and ensure that your management is tailored to you. In the fact that they understand if you have the allergies to medications, they'll pick the right medications for you to take, and see the mitigating factor and risk factors that you do have, and if any other complications that you do have as well. Because one of the things that people tend to forget is that in the pre-diabetic state, I'll use the word the microvascular changes, meaning those damages that happen in the eye, in the kidney, and the nerves, really do begin to take place in the pre-diabetic state. So by the time you become diabetic and you have the diagnosis, some damages have already been done. So the first thing I would advise anybody to do is seek help from a competent doctor, where they'll sit back, look at your results, and then come with a profile for you that suits you better. Now we have different medications. Metformin is a big one, which is cheap and manageable, but we have other medications now that are out there that will really do help. And again, diet. If you notice, back in the days, we ate more things that were bitter. We had bitter cola, bitter leaves, and all that. But all of that diet is shifting away from that, where we're eating more refined food. And, you know, because of the essence and the need for us to move, you know, very agile, we're eating more of fast foods. And this is causing a whole lot of damage as well, because most homes don't have the time to prepare the food and all that. So the primary thing is, one, eat what you make. It's important. Now, when you already have that, choosing the right doctor for choosing the right medications, because diabetes management is very expensive. It's costly. Now, I think 2 years ago, about a year ago, the average of managing diabetes in Nigeria without complications was 163,000. With complications, 244,000. But now with the increase or depreciation of the dollar, you can imagine the naira, that has gone up to about 600,000 naira without diabetes, about 900,000 naira with complications. So it's a very expensive thing to manage. And if we do not have the right approach in managing it, then we're in for a big, big shock. Nigeria and the federal government and state government and the local government, they ought to come together and have a consensus, definite program that will have to address this issue, because the tsunami is coming. I've seen what is done here in the United States, and that's why it's important that they begin to sound the alarm bells back home in Nigeria, that we'll be prepared.
Right, and you know, let's even talk about that worst case scenario now, help us understand really what we are dealing with if, governments of the day do not take this head on. Because earlier on, your last response, sparked up a lot of issues for me. First, the cost of drugs, of course, that's skyrocketed in this part of the world. The sufficiency of health personnel capable of managing this condition is also another issue. And now you're talking about the crucial role of government. So help us understand, the future evil, that is needed, that we need to ward off, what governments need to do, what we are really facing, dealing with, I should say.
Well, I'll take it in three prongs. There's a primary personal responsibility that every Nigerian has to have when it comes to their health. And I always tell people this, I've been schooled in Nigeria, primarily Bello and all that. We always have had a lackadaisical attitude approach towards our individual personal responsibility to health, where a lot of Nigerians don't want to pay because they just feel it's free. No, healthcare is not free. And we must understand that as well, state, local, and federal government, on a concise approach and manner upon which they would also contribute in the direct care of individuals with diabetes, saving costs and saving lives and livelihoods. Now, the federal, government at every level, from the federal government level, will have to have what would I call it? A task force for diabetes, because diabetes affects every tissue in your body, and it's going to be a major cause of a healthcare emergency that we're going to see in the next decade or month or so. I've tried to sound this alarm for the last 10 years, giving talks in Nigeria, spoken to individuals, NGOs, and all that as much as possible, begin to sound the alarm. So a task force at the federal, state, and local level, so that, one, increase awareness for people to take care of themselves, get screened,
right,
which is really important.
Right.
And then making medications available. Here in the United States, metformin is very cheap. There are some pharmacies that will actually give you metformin for free. My desire, and those who I hope be able to work in that space, should find a way where the federal government would have to subsidize metformin dose for those who have diabetes. There's one thing we must begin to subsidize, is a medication for diabetes. And they can work with NGOs like the WHO and other pharmaceutical industries to make this relatively cheap or even free, as a matter of fact, just as they've done with HIV meds. Because we're moving from infectious disease to non-communicable disease, and this is a big issue. And I'll tell you this.
All right.
Diabetes,
right?
As we say right now in Nigeria, 1 out of 17 Nigerians have diabetes.
All right.
And the data on death,
we've run out of time.
Globally, 1 person dies every 5 to 6 seconds out of the causes of diabetes across the globe. So it's a big issue, and we must begin to truly pay attention to this.
All right. That's all the time we have for this conversation. Very much needed. And we thank you very much for your contributions on the program, TVC Breakfast, Dr. Nelson Aluya. Thanks again.
You're welcome. Thank you.